The house is on fire. How can we swap healthcare in crisis to profitable systems? Former CEO of Jefferson Health, having radically transformed a 30,000 employee health system on the principles of value-based healthcare and patient centricity, changing incentives and culture, driving hospital growth, powered by value leading to volume. From a 3 to 18 hospital system between 2013 and 2021.
My Wharton professor used to say, you should always have 5 people under you that think they can do a better job than you and 3 that are right. I've never opened Excel, and I ran an 18 hospital system, but I didn't try to pretend I actually knew how to run hospitals. But I'm a DJ, and I'm a really good communicator one-on-one with people.
We have the wrong incentives. Paying for procedures, pills, and services is leading to more procedures, more pills, and more services.
One of the things that I had done when I graduated from Wharton is I looked at health systems websites, and they were all, community engagement, diversity, patients first, access. And then I would call the CEOs of those health systems. And that's in America, so, to be fair. But I would call the CEOs, wow, I love your website. So I'm just assuming your long-term incentive and short-term incentive plan is around community engagement, diversity, access, reducing health gaps, innovation. And they very seriously said, no, let me go. My incentive plan is around EBITDA, hospital census, the docs I play golf with like me,
RVU.
and U.S. News and World Report and RVUs. Yeah. So my conclusion was that if you want to look at what a health system is going to look like 10 years from now, ignore what's on the website, ignore what the board says, and look at how the CEO gets paid. Again, part of the problem of being a transformer, disruptor, and innovator, and you start to write stuff like that in your books, and now you become a CEO. It's like, damn, I can't be the one that, because that was my incentive. My first year, I'm saying, hey, we're all about innovation. We're a 200-year-old thing like it's, we have the second poorest city in the United States. We're going to change all that. And I looked at my long-term incentive, and it was exactly what I had been railing against. So I changed it. We changed it. And, 25% of my incentive, for example, was reducing 5 health inequities in Philadelphia, none of which I had any control over, by the way. But I'll give you a real example, Verena. We changed benefits. An 18 hospital system, we changed benefits. And I go, how's it going? We hated President Klasko, and they went through 2 or 3 things where we had to pay $200 for, and I next morning was my cabinet meeting. I go to our CHRO and I go, so how's our benefit thing going? What do people think? And he goes, oh, they love it. I said, no, they don't. He goes, oh, no, they love it. After like the third of them, I said, I'll tell you what, let's play poker. You tell me how you know they love it. I'll tell you how I know they don't, and we'll see who has a better hand. How do you know they love it? Well, my head in my office, I went downstairs to my head of benefits who told me they love it. Okay, that's like you got 5 cards, jack high. Let me tell you about my 4 aces. The hot dog stand, people were almost crying. So you have a day to change that. I can't change it. All right, let me make this clear. You have a day to change that, or I have a day to get a new chief human resource officer. I never would have known that if I stayed in my office.
Get out there to involve your organization. The future is consumer-based healthcare at any address. Setting up your hospital so that patients want to come and leverage digital tools.
It hasn't happened.
Yes.
And it's almost become, it's become something that, at least in America, payers are saying, "Oh, we believe in value-based healthcare." No, you really don't. Okay, so to your point, I don't use that word anymore. I think w- I, I just published a book 2 weeks ago that got published by the American College of Healthcare Executives called "Patient No Longer." And I love your book because we need to tango with patients and get a lot closer. But I think the what I like to think about is, instead of value-based care, consumer-based healthcare at any address. And that's not healthcare at home. That's not urgent care. That's not it's healthcare at any address. And if you think about it, Verena, that's what other sectors have done. Retail, Target, I spend time with Target and Walmart. When when Amazon disrupted that thing, there's some people said nobody's ever going to store again. And there was a thing in America called Circuit City. They stopped all their stores. They couldn't compete. There are other places that said, "What a stupid idea." Macy's, Sears, Penny's in the United States. Target and Walmart said, "We're damn good at what we do, but we have to be just as good at reaching consumers the way Amazon is." If you have pancreatic cancer, and any of the hospitals that your audience is at, those patients don't care what their digital strategy is, what their TV is like, or what their food is. They want to go to the best surgeon and live. But what we fail to recognize is the 97% of people that wake up in the morning and don't feel like a patient in whatever city you're in. It doesn't matter whether you're in Philadelphia or Miami or Stuttgart or Copenhagen, or Tel Aviv, or Riyadh. It doesn't matter.
We need to tango with patients. Get a lot closer. Take a consumer view. Understand their needs. And segment our offerings to these needs. That way, we will improve outcomes and grow volume through value.
You might have diabetes, you might have congestive heart failure, you might have COPD, but the new healthcare is those people don't say, "I'm a patient." And if you're a CMO or a CEO that can only think of patients, come to my office, come to my urgent care center, come to my hospital, come to my ER, you're going to fail. So I think that the key is, how can you work with whatever digital and AI companies you need to work with to create healthcare at any address in a consumer segmented way. The reason you have such a tough time answering the what do outcomes mean to patients is we've done a really, really, really lousy job globally at consumer segmenting. If any of the people in your office have a billboard in whatever language that says, "We're so and so hospital, we are patient centered," I laugh. Because are you patient centered for somebody like me who's a 71-year-old marathon runner with 5 wearables? Are you patient centered for a 28-year-old disengaged person that really doesn't care about his or her health? Are you patient centered for a 50-year-old obese person that has there's no way you could say, what does outcomes mean to me, Joe and Mary over there? And by the way, if you get back to my Amazon example, they have 1,871 different outcomes for how they've consumer segmented the population. So what I think we need to do is A, recognize that what is our relevance to people that wake up in the morning and want to thrive and not have healthcare get in the way. B, do a really good job of consumer segmenting. And we're not going to be like Amazon, but at least be able to look at your community and say, here's 10 different types of people. And I'm gonna have programs and communications that are different around those 10 things. And then eventually maybe AI will help us get more like Amazon where there's a lot more segmentation. And then the third thing is, I know this sounds really revolutionary, but like maybe we should ask people, you know, I mean, how many doctors out there actually say, "What would you like to say about yourself 5 years from now?"
1. Focus on one condition and segment to people's needs: clinical, emotional, societal. 2. Align all actors: doctors, nurses, social workers. 3. Jointly define outcomes: proms and croms. Collaborate to innovate. Think like a startup company.
It made sense to me that if everything else was going toward healthcare at any address, and in 2020, I wrote the book with Hey Montanasia on healthcare, a manifesto for health assurance, that basically started, which has really become my life. What if a Silicon Valley entrepreneur and a CEO of an academic medical center had a baby? What would that baby look like? And I think, my current life at age 71 is trying to rear that baby of what's happening out in a General Catalyst, or Sheba Medical Center in Israel type model of entrepreneurism, with the good and bad of what's happening in, academic medical centers in Germany or Vienna or the United States.
Catalyze novel ideas across the intersections of academia and entrepreneurism. Understand their pains, feel their needs.
And most of the people in some of my competing organizations would tell my folks, "Boy, this guy doesn't feel our pain. He's sitting up in his office. It's so cool that your guy's doing this thing with songs." And then the third one I'd give is, this would fall into the being real. The first time I got to Jefferson, and I was probably not everybody's choice because I wasn't the most academic place, and I was the first both president of the university and CEO of the health system that they had ever had. And it was a very conservative place. And again, I just got up there and said, "Tell me something really, really, really exciting about this place that somebody want to give $110 million or something to." And said, "Well, we're number two to Penn and we're better than Temple and Drexel." I said, "Well, opposite of exciting." And I don't know if any of that's true. Um, so out of that, I said, "Well, somebody else raised their hand and said, to give us more money for NIH funding and get us a proton beam, we can get closer to Penn and US News and World Report and research rankings." And I said, that'd be like if height and hair were the two most important things, I would not have applied for this job. And we came up with this model of, what if we're a 200-year-old academic medical center thinking like a startup company, which revolutionized Jefferson. So the reason I'm saying that is I got folks to think what I'm good at. Like, I wasn't going to be the academic to get them closer to University of Pennsylvania in US News and World Report research rankings. And by the way, that wasn't going to happen. As it turns out, we became a US News and World Report elite honor roll hospital, but mostly through innovation and that kind of thing. So I think that those three things, which if you think about them, think about what you're good at and play on that strength in communication.
Get out there. Think like partners. Search for novel partnerships. Act outside the box.
Novartis did a thing around cardiovascular disparities. Again, we didn't have any special relationship with Novartis, but those were the things I was out there looking for, because not just because of my incentive, but because it matched, and then because I did that with my incentive, it would go down the piece and say, you have to do this.
People before process. Innovation happens through connections, by finding the right match. Leadership and the music. Dr. Klasko, any recommendation for the first 100 days in the job as a healthcare leader?
If your chair is warm in your office, you're doing something wrong in your first 100 days. And the third thing would be, I think, literally, as you have like 50 days where they're not going to fire you, and figure out a way to get the organization into your lane. I think there is an opportunity to do things in your first 50, 60 days that you would never be able to do again.
To DJ Stevie Klasko, how does the theme of the music elevate healthcare?
I had about 35% of my employees were of color, and it was an angry time. People were protesting in Philadelphia. I didn't do the I understand your pain. I did playlists because every Friday I sent a playlist to my 35,000 employees. So during the George Floyd murder, I sent a playlist, and one of the songs I included, Verena, was a song by the Impression, Curtis Mayfield and the Impressions, called "Choice of Colors." If you had your choice of colors, which one would you choose, my brothers? If there was no day or night, which would you prefer to be right? I got about 300 emails back around, interesting that you included that song. That's a very optimistic song. We're not feeling very optimistically now. It's interesting that same year was a song by Gil Scott-Heron called "The Revolution Will Not Be Televised," which is how we're thinking. Next week, I would put some of those responses. The reason I think that was so impactful was I was coming to them as a DJ, something I know, sending them songs, and they felt every bit as comfortable sending songs they thought were more fitting to a DJ. In fact, I signed it like Stevie K, the DJ.
What a revolutionary idea. Go and ask people. We need to tango more with patients. What are you doing tomorrow?